But in doing so, when it makes that template of what it's making the antibody against, it also makes it against the covering of your nerves. And so you wind up getting demyelination of your nerves, and Guillain-Barré can be very severe. People can be in the intensive care unit on respirators for even months until they start recovery. Luckily these days, with good medical care, most of these patients actually do fairly well these days. But there is an association with infections and causing an autoimmune disorder, but I think you have to look at the type of infections as well as the time period. And also you have to remember, we really don't know everything.
All right, I'm going to take this next question, which is, I think, an excellent question, and I think, Dr. Kaplan, I'm going to ask you to address this if you can. Although not an autoimmune cause of fatigue, someone asked about mercury toxicity as a cause of fatigue. And I think that if we can address that, and at the same time, we should also think that, and I'm realizing that this really wasn't brought up tonight, sometimes fatigue can also be a result of medications that we take. I think a great example is beta blockers and other antihypertensive agents can often cause fatigue. So sometimes things that we do to help patients can cause fatigue. But if you want to talk maybe about mercury toxicity.
Sure. Well, anyone here ever read Alice in Wonderland? Ever hear of it? Mad as a Hatter. And that's because what they did is they treated the pelts with mercury. And so the people that were doing it developed mercury toxicity. Mercury toxicity is actually fairly interesting, and there have even been cases in this century where they've, well, I should say last century, where there were large outbreaks actually